Hi there. It's time to start coming out of our cocoon a little bit, and so we've thought maybe this would be a good time for us to have a little conversation, just to review where we are, where we've been, where we need to be regarding this crazy COVID-19 virus. Let me swing this around so that it's the way it's supposed to be, um, as we have taught you to do it correctly. So, it's exciting that we're at a point now where we can start coming out of our shelters a little bit, but I think it's really important for us to remember that this disease isn't gone. This is a problem we're going to be dealing with for a long time. The problem with this virus is that it's quite contagious and it's not super lethal. And so, you have a disease, that has a super high mortality rate, like Ebola. There's a disease that people that got Ebola died. So you could figure out, who has this disease. You could try to sequester it in a smaller area. And then when people stopped dying, they knew that, that they were in a better position to allow people to start, interfacing once again. This particular virus is lethal to some, but it's not very lethal to many others. And so we know that, probably about 20%, maybe 1 in 5 people that get infected with this virus don't really show significant enough symptoms that they're even aware that they have the disease. And so as a result of that, there's a lot of disease that's spread out around the world. A lot of people that were sick and didn't know that were infecting other people. And then unfortunately, some people are very, very sensitive to this virus, and so there's a high mortality rate. And so we've done a spectacular job in Oregon, and really pretty well, in a lot of places, with following the orders the recommendations that we've been given to try to shelter in place and to allow this disease to kind of run its course among many people so that it's not quite so prevalent. There's not quite as much disease out there. And I think we're at a pretty good place right now in Oregon. The last, Southern Oregon, the last few days, I think we've had one person test positive for this disease over the last 4 or 5 days. So there's probably not a ton of people out there that at least are being tested that have this disease. Of course, there may be a lot of people out there that have this disease that don't know it. And so there's still disease in the community. And then as people start moving around, we're going to have more cases. And so we need to presume that everyone that we encounter could be infected. And we need to also presume that we could be infected. And that means that we need to not be distributing disease to those around us, and we need to make sure they're not spreading disease to us. Most of you are in an age group that are not particularly high risk for having, a lethal outcome if you do get infected. But unfortunately, our patient population is elderly. And so there are a lot of people that we really need to be very concerned about getting this disease. And so sheltering in place was a good way to say, let's just shut down things and let this disease kind of run its course over the couple of weeks that it may be active in as many people as may have this disease. And now we need to start loosening up a little bit, but still be very cautious. So it raises the question of how does our body respond to being exposed to this virus? What do we do? What happens to make us tolerate or become protected from viruses? And so as we get exposed to viruses in the world, and there's lots of things that we get exposed to, as you become exposed to that particular virus, your body builds a response. Cells create antibodies to try to control this and make it go away. And so the more people that get exposed to the virus, the more people have this protection, if they were to get exposed to it again, that will prevent them from getting sick. And so there's something called herd immunity, which is just there's a lot of people in the world that have exposure to this particular virus, and so they're not going to get particularly sick if they get exposed to it again. Unfortunately, this is a new virus, so we don't really have a lot of herd immunity. Even in places that there have been a pretty significant number of cases, like New York City, maybe 10, 20% of people have been exposed to this thing, and most people have not. So we still need to be really aware that most people are going to have a bad reaction potentially if they get exposed to this virus. The other way that we protect is by getting vaccinated. And so those of you that are getting your yearly flu shot, great. You're in the minority, unfortunately, but you are having an added level of protection so that your body has now been exposed to some variation, not the actual active virus itself, but some variation of that virus that it can create a response to, so that when it does get exposed to the true contagious sickness creating virus, it can create a response to that and prevent us from getting sick. So vaccination is going to be the ultimate solution, the cure to our world pandemic problem, but it's going to take a long time to have that. So it's going to, whether it's going to be a year from now or whenever that we have a vaccination for this, until that point in time, we got a scary problem that we need to be really cautious about. So how does this virus spread? Well, we know that it likes to hook on to saliva and things that are related to our mucous membranes. And so when we cough, when we sneeze, we're throwing these little tiny particles of our saliva into the atmosphere, and that's where the virus is living. And so it doesn't tend to linger in the air for a really tremendously long period of time, but there is certainly some movement of particles that may have virus containing in them in the air. So we need to be aware that just the air that we're breathing may have virus in it. But more significantly, this virus tends to settle on things, countertops, doorknobs, your hands. And so that's where the major concern of spread is, that every time you have virus on your hand and you touch something, the virus gets somewhere else, and then somebody else touches that, and then they get themselves inoculated with this virus and they get sick. So we need to assume that every surface that we touch, when you go to the grocery store, those 15 people that are squeezing the avocados, they're potentially putting some virus particles on those avocados. So you got to be aware of that. Every countertop, every doorknob, you need to assume has virus particles on it. So whenever you touch anything, you need to wash your hands to try to, prevent spreading this virus. The other thing that we know is that just coughing, breathing, whatever, there's some virus particles floating around. And so that's where we try to block that with the various masks that we use. Now the supercharged mask, the N95 mask, is one that is more closed off, so the air can't really get in without going through the filter of that mask, and that's designed in such a way that it would block these virus particles from actually being inhaled. But unfortunately, those masks are in relatively short supply, and so not everyone has access to those. And so we find that if we have a mask on you, you're preventing spitting these particles out that have virus on them. And you're probably getting a little bit of protection from virus particles coming into you, but they're still sneaking around the side of the mask and getting in somehow. So don't feel just because you got a mask on, you're protected against getting this virus. But if you and the person you're dealing with both have masks on, it's probably a reasonably effective way of preventing this virus from being spread through these little particles that are being spewed out in the world. So how do we avoid getting infected? Well, isolation is great. Find a population of people that you live with that are not sick and only deal with those people. Don't go outside. Don't touch anything outside in the outside world. When you do go in the outside world to get your groceries, wash your hands continuously several times when you get home. Whatever you need to do to prevent bringing virus particles into your home environment is something you need to do, and that's been quite effective, as we've seen over the last several weeks. But we're not going to do that forever, and so we need to kind of get into some sort of a transition phase where we're doing some things to continue to protect ourselves with still being able to interface. And so that's the phase we're entering into now as we're starting to see more patients at work. Don't touch your face. The virus is spread through mucous membranes, which means your nose, your mouth, your eyes, those have mucous membranes, and that's where this virus is getting captured by your body and then creating this infection that we need to try to avoid. So when you touch your face, your eyes, your nose, and if you did have virus, you're potentially spreading it to other people. And if you've got virus on your hands and you do those things, you're potentially infecting yourself. Wash your hands, and wash them for a long period of time, 20 or 30 seconds. Make sure you get, fingertips and between the fingers, and lengthy routine around your ring, back of your hands, everything. Do that a lot. That washing your hands tends to kill off this virus and protects others from being exposed to it if you did get exposed to the virus. So washing hands is a key component, but we're going to now try to encourage everybody, in addition to washing your hands a lot, to wear a mask. So you're going to wear a mask, and the patients are going to wear a mask. And in doing so, there was a study I was looking at this morning out of one of the hospitals in Boston, where there's a much bigger exposure to this virus in the community, and certainly healthcare workers were found to be at some higher level of risk. That they found that if they put masks on the patients and the healthcare providers, they had a huge reduction in the amount of infections that were being spread. So we're going to have everybody wear a mask. You wear a mask, they wear a mask. Wash your hands when you put your mask on, when you take your mask off, etc., to try to make sure that you're not spreading any virus around. So as we watch you in this environment, what are we doing wrong? Well, when I walk through the nurses' stations and other places, and I see people standing, 1 foot apart from one another, not so good. We know that when we breathe and particles are spewing out from the sides of our masks, they're going a distance that's more than a few feet. They're probably going 6 feet. And so we try to stay 6 feet from each other at all times. You're going to have your momentary passing between each other, where you're going to be less than that, but just whenever possible, try to back away and be 6 feet apart from one another. Other thing we see a lot of is people playing with their mask, playing with their face. The mask is on, the mask is off. You're doing things that potentially there could be virus on the surface of your mask. And so you're touching your mask, and then you're taking it off, and then you're touching your eye, you're touching your face. You're spreading disease when you do that. You touch the countertop, you touch the doorknob, and then when we come through and touch the doorknob after that, we're getting exposed to the virus. So put your mask on, wash your hands before you put the mask on. Put your mask on. Do not touch your face. Do not mess with the mask. Do not do anything relating to the mask. Leave it on. Whenever you are in an environment where there are other people around you, we want you to have your mask on. When you're eating lunch in the cafeteria, you obviously can't eat with a mask on. So you got to take your mask off to do your eating. When you're sitting in your office with your computer and there's nobody around, you want to take your mask off. Wash your hands, take your mask off, try to slide it behind you if it's one of these kind of masks so that it's not in the way, and do your thing. And then when you resume, wash your hands again, put your mask on, wash your hands again after you put your mask on, so that you're not spreading any particles that might be on your mask to other places. Gloves. Gloves are akin to your hands. So if you have a glove on and you touch something and you take the glove off, you don't have any virus on it. If you put a glove on and you then go to the typewriter and then you do something else, you touch your face, you do whatever you're doing, you're spreading virus all over the place. The glove is not really protecting anyone, but when you take it off, you're taking whatever was on the glove off. So if you got gloves on, great, leave them on for a short period of time, or wash your hands with the gloves on to get the virus particles off of the gloves. Just because you got gloves on doesn't mean you're not spreading disease and not contaminating things. And so if you're wearing gloves, just take them off before you're doing stuff. Wash your hands in between, do all the stuff you're supposed to do. So hopefully that gives you a little bit of an idea of what we're looking for. We want you to separate as far as you can be separated. We want your masks on whenever you're in any regional contact with other people. We want you to not be messing with your face when your mask is on. We want you to be aware of what gloves are actually doing. And I think if we can really be super cautious about all that, we're going to get through this next phase, which is going to go on for months, without making our patients sick, without making each other sick, and getting through all this. This will pass. I mean, as time goes on, we're going to get vaccines, we're going to get perhaps better treatments. We will start developing some of this herd immunity as more people get exposed to this disease, but we're in a rough phase right now that we just need to learn to do things differently to try to protect one another. So hopefully that's useful, and we'll be watching. Okay, take care. Bye.